Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Diabetes is common. Unfortunately, it's the seventh leading cause of death. And if you have diabetes, you're going to have a number one cause of renal failure, lower extremity amputations, and adult blindness. 4 in 10 adults in the U.S. who died of COVID also have diabetes. And the prevalence of undiagnosed and diagnosed diabetes in the United States is astronomical. The pre-diabetic rate of 96 million, or 1 in 3 in the U.S. population, estimated at about 332 million in 2022. And the incidence is tripling since the 80s. So when we take a look at this world map, we can see that right now it's estimated at about 415 million, and that number will bounce up to about 642 million by 2040. Some of the faster growing regions we'll take a look at together. The global burden, huge. 537 million people in the world currently have diabetes, and that's only going up. In some areas in Africa, the increase will be by 134%. Southeast Asia and Europe trailing behind. In Australia, 1 in 20 or 1.3 million are affected. And China has the highest number of cases with 141 million diabetics. The French Polynesians with 27% of their population suffering. And we can see that even when you look at different geographies, there's also differences amongst race and ethnicities. In America, American Indian, very high, Black, Hispanic, people of color, preferentially affected over white. And it's expensive. $327 billion a year to the total cost of diabetes in 2017, and $237 billion went for the medical hospital inpatient costs. The $90 billion in reduced productivity are paid by the anxiety, depression, and otherwise difficulties patients have in returning when they have amputations to work. Up from 2002, the diabetic cost was about 132 billion. And these are numbers also with projections as to how much money is going to be spent by 2040. And when you look in Africa, 3 billion to 6 billion in the world. When you look at these regions of what we're spending, astronomical increases in expenditures in money that could be better spent elsewhere. Diabetes is expensive. The global cost of diabetes is expected to reach over $1 trillion in 2030. 3 out of 4 patients with diabetes live in low and middle income countries. And when you consider that the United States average cost, even through non-surgical patients, is about $12,000, followed by Switzerland and Norway, 9,000. These are big numbers, even for patients who are relatively healthy. And this chart helps us to see the global health expenditure due to diabetes is estimated at a world cost of $966 billion, and the United States is a far leader in this area of spending money in this region. US and China actually lead the pack, with China behind it, $165 billion compared to $379 billion. And for this money, amputations continue to rise. When we look at these charts which describe lower extremity amputations, we look at the top charts that reference the diabetic population and the lower charts the non-diabetic population. And we can see the non-diabetic population, your straight peripheral arterial disease patients and what's in that category, is petering out to a more plateaued line, where diabetic, you're still having a slight increased slope, and that's seen up till 2015. When we look at the levels of amputation and what's going on, we can see that there's still an increasing rise in amputation in the diabetic population. More disturbing is that there's geographic and ethnic inequalities in diabetic-related amputations. So they looked at this study in the risk of amputations of lower extremities amongst American 1 million Medicare beneficiaries, and they found that if you were African American, you were significantly less likely to undergo revascularization when compared to a white patient. And when you think about what that means, we know that the major mortality risks of chronic threatening limb ischemia increase above a BKA or above, and the 3-year mortality is significantly higher. So patients who are offered other treatments like peripheral arterial disease treatments where there are revascularization procedures, stents placed, those patients may actually have decreased mortality because they're getting treatments that actually make a difference to their foot health. So that's something for us to understand, that there may be inherent healthcare disparities embedded in this disease. What can we do about it? We can check our patients. An annual wellness check makes a difference, and that was brought out in June 2022. They looked at a study at the diabetic belt, and they found that those patients that were actually coming to attention had better mortality and morbidity outcomes than those who were not seen carefully and evaluated regularly. I personally wrote a paper that looked at the prevalence of obtaining an amputation after you received an early MRI. I wanted to see whether obtaining an MRI really made a difference. And what I found was that it didn't statistically make a difference, but it did make a difference, it seemed, in the death rate. And that was even factoring out things like a cardiac risk. And the supposition I wrote in that paper in 2016 was that perhaps we were seeing our patients more regularly by inviting them for their MRI. There was someone looking at them, and this extra level of care may be impacting the patient's eventual death rate. So take a look at that article. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.